Good afternoon. Today is Tuesday, the 2nd of February 2021, and as always, the English language summary of the daily press briefing for today. We have yesterday as the first day of relaxation of disease control measures across the country, as many of you know. Many of you may have asked about the English language information and the information in terms of the provincial measures, in terms of the disease control zones, and corresponding measures for each zone, which I had recapped yesterday, actually. I'd like to share with you just some infographics at the outset here, prepared by the Tourism Authority of Thailand in this regard, which is about the list of provinces with the disease control zones. Just to be in a clearer kind of categorization there. Yes, so you have the names of the provinces in each zones that we recategorized, which became in effect yesterday, the 1st of February. So as you can see, there's only one province left in the maximum control zone, which is Samut Sakhon province. Four provinces are in the highly controlled zones, which are Bangkok, Nonthaburi, Pathum Thani, and Samut Sakhon. And the remaining 72 provinces, or the majority of the provinces, are in the controlled, high surveillance and surveillance zones, which means that no new cases of COVID have been reported for over a range of a few days, as I mentioned yesterday, around 7 days or less, to more than 1 week. And the Tourism Authority of Thailand has also prepared a detailed list of establishments which have been allowed to reopen with strict disease control measures, and a list of establishments which remain closed in each zone. So please make use of the infographics that you see on screen in the website of the Tourism Authority of Thailand. Yes, so moving on to the general situation and number of cases that we have recorded for today. We have new confirmed cases recorded today is 836, the majority, 710 of this out of 836, the majority is from active case finding as in the past days, making the cumulative number of cases in Thailand now over 20,000. I'd like to note that this is actually a benchmark, which we still have to be very cautious about. The benchmark is that we've reached over 20,000 already today in terms of the cumulative cases counted since last year. Number of recoveries, we have 703 recoveries recorded for today. That's actually a high number of recovery compared to other days, making the cumulative number of recoveries over 13,000, as you can see on screen. Active cases still being treated in hospitals, in our field hospitals, in our quarantine systems and the like, those who are still being treated is 7,158. The cumulative number of fatalities now stands at 79, and quite sorrowful to report that this number includes 2 new fatalities recorded, and I'll give you some details of that shortly. Just some observations from the new cases. Of the new cases reported, 109 cases were found in hospitals and healthcare facilities, the majority from Samut Sakhon province. The 710 cases from active case finding, the majority, which is 688, are from active case finding in Samut Sakhon in particular, and the remaining 22 cases from active case finding in Bangkok. So such active case finding will continue. We can expect the daily number of COVID cases to remain relatively high. But as I have said, remaining relatively high from our active case finding methods, our missions. These active case findings are held in factories, and mostly we found positive cases among the migrant workers in Samut Sakhon factories. As previously mentioned, the no cause for alarm, it reflects the efficiency of our public health system in curbing the spread of the virus. Today, in the number recorded for today, we also have within it 17 new cases of COVID from overseas, which were detected in the state quarantine system. from those flying in from overseas, from abroad, coming straight into our quarantine system. Just to remind that international arrivals, all international arrivals, of course, will still have to come into the mandatory state quarantine system for 14 days in Thailand. And with regard to the 2 new cases of fatality today, we, of course, extend our deepest condolences to the families and friends of the deceased. The 78th fatality is a 75-year-old Thai female who was unemployed. She had underlying health conditions, which include high blood pressure and high cholesterol. She was previously in contact with a confirmed patient, positive case, and was residing in Samut Sakhon province. The 79th fatality in Thailand is a 68-year-old Thai male who was a trader. He similarly had underlying health conditions which included diabetes and the final phase of kidney disease, kidney failure. He also had a previous kidney operation, and was residing in Bangkok at the time of his illness. It might be noted that the elderly and those with underlying health conditions are most at risk for dying from COVID, from the information and statistics that we have had here in Thailand. So moving on, as mentioned yesterday, I'd like to focus on one particular province as a case in point, which I mentioned yesterday already. So it's Maha Sarakham province, the Maha Sarakham cluster. We have a new cluster in Maha Sarakham which originated from a social gathering. Now, when I say social gathering, I have to explain that a bit. It's actually an illegal loan scheme or an illegal informal loan scheme, or what we call in Thai tok share, or the share table, so to speak. But it's an illegal loan scheme for that purpose, gathering for that purpose. And the health ministry has prepared an infographic to show how the index case, the circle in the center, if you can see the largest circle, that's the index case, for the first or the first person from this cluster, how it spread the virus to his family members and to other members socially at a social gathering, so to speak. It's actually a illegal loan scheme gathering, So the white circles on the screen are family members, and the red circles are those who contracted the virus at the social gathering. One person here is from Khon Kaen province, which confirms that COVID can still spread through inter-provincial travel, and that we still have to remain cautious no matter where we are in the country. Another important issue which was touched upon yesterday as well is about coping with stress, managing and coping with stress during COVID, because physical distancing, of course, is the best precaution that we can take right now and reduce the spread of COVID in our communities. However, physical and social distancing, in some cases, self-isolation can be quite stressful. And as the COVID pandemic and its far-reaching implications continue to unfold globally and in Thailand, it's quite normal for people to experience a wide range of thoughts or feelings, reactions, including stress, anxiety, worry, sadness, frustration, loss of interest in the usual enjoyable activities, restlessness or agitation, feeling helpless or feeling disconnected from others. So there are strategies for that when many things feel uncertain and out of control. One of the most effective ways to manage stress and anxiety is to focus on actions that are in our control. And we had coming up for you many infographics from the World Health Organization on this issue. Some ways you can take intentional steps to look after your physical and emotional well-being, such as learn how to protect yourselves and others, and actually learn the actual actions you can do. Second is acknowledge your feelings. Third, maintain your day-to-day activities and routine as much as possible. Fourth, stay connected. Remember that distancing does not mean social disconnection. So distancing is different from disconnection. Fifth, contribute. Show that you care your friends, family, and those vulnerable in your community. Six, seek accurate information and set limits on the time you allocate to consume news, especially on social media. Have a time limit on that. And seventh, share your feelings with family and friends and seek advice on mental health from specialists when necessary. And just to note that later on today and in days in the future, and this afternoon actually also, we'll be having certain programs in Thai language, and some of the programs will focus on keeping a strong mental health state. So this program will be in the afternoon today, and in the other episodes of this program on Channel 11, we'll have different issues, including how to maintain your mental health and well-being. Advice for the elderly, for older adults and people with underlying health conditions. As many people are returning to offices, schools, and universities, the Health Ministry has emphasized that personal precautions against COVID must still be strictly practiced. You cannot be certain whether you, your friends, or your colleagues have been infected with COVID or not. And if your family members who have been having underlying health conditions or avoiding unnecessary visits, these types of information could actually save lives. Alternatively, socialization with friends and family can be done through phone or video call. So the Public Relations Department and the WHO prepared some infographics. Advice for older adults and people with underlying health conditions, and you see that on screen. How to take care of the elderly during COVID. Some actions include regular cleaning and disinfecting of hands, separating meals and utensils, personal items, mask wearing, and the like. While staying at home, do not forget to be active and positive as well. So these useful infographics you can find on the social media platforms of the PRD and the World Health Organization. So as we start to relax COVID measures, just to say some precautionary measures that should be maintained, most especially one important issue is about schools, of course, as I mentioned. And as Dr. Tuisin mentioned just now as well, on the good news that sometimes you want to portray, on the good news that students, children are going back to school, they're happy, but of course the precautionary measures still have to be still have to be abided by. So education institutions, since they have been reopened, except in Samut Sakhon province, on screen we'll have a infographic on keep schools safe during COVID-19 and always. And it includes staying home when you're sick, keeping a distance of at least 1 meter apart, and the other types of measures. Important to be welcoming, respectful, and inclusive of your precautionary measures and extend support to all. We also have some photos of precautionary measures taken at actual schools to prevent COVID, such as cardboard partitions at school desks, with clear plastic film serving as windows in the middle. You see that on screen. This will protect students in schools while allowing them to see each other, interact with each other, or talk face-to-face instead of on a screen. I think that we all, just like the children, we all miss seeing each other and socializing in the normal mode. So I hope that we will continue to work together to flatten the curve for the new cases and be able to further relax measures in the weeks ahead. Now, given that the majority of the new cases have been detected in Samut Sakhon, just to express again our appreciation and to send the moral support to people there, to all the communities in this province in Samut Sakhon. Just now, Dr. Tuisin had shown some clips of the schools and of Samut Sakhon as well. And here, for me here, we'll have some still pictures of the work in Samut Sakhon so far. So as you can see, we have cooperated with health authorities in terms of arranging the various queuing for medical checkups, filling up of the travel permit forms, scanning of the Mo Chana QR code for the purpose of contact tracing. And there you see on screen a motorcycle taxi man entering the province and scanning the Mo Chana, a large Mo Chana QR code on his phone. And of course, in terms of the checkpoints for screening, that is remains our vigilant mission, a mission that is vigilant, that is serious and very important for us, especially in Samut Sakhon. And that is one checkpoint that you see on screen as an example. Yes, so basically I've recapped and covered what Dr. Tui Sin had briefed to you today with some additional information. So I hope that this was useful. We will continue to update the information. As mentioned, the middle of February may be perhaps our next cutoff date, our next goal, our next timeline, so that we can see how our measures, the measures that we are very seriously, very efficiently trying to implement, to see how effective that would be. By the middle of February, we might have more relaxed measures, as mentioned before. So hoping to report to you good news during that time in the middle of February. So thank you very much for your attention for today. This is all I have, and we'll see you again tomorrow. Thank you. สวัสดีครับ
ขอขอบพระคุณครับท่านณัฐพานุ นพคุณรองอธิบดีกรมสารนิเทศและรองโฆษกกระทรวงการต่างประเทศครับรายการที่ทำเนียบรัฐบาลในช่วงบ่ายนี้ 14 นาฬิกาคุณผู้ชมสามารถติดตามได้ในประเด็นที่เกี่ยวข้องกับเรื่องสุขภาพจิตนะครับจากมาตรการการล็อกดาวน์และการปิดกิจกรรมต่างๆนั้นส่งผลต่อสุขภาพจิตของคนไทยมากน้อยแค่ไหนและวิธีการที่จะป้องกันและแก้ไขในระยะยาวจะเป็นอย่างไรสามารถติดตามได้ใน MBT รวมใจสู้ภัยโควิด -19 ทำเนียบรัฐบาลครับนี่คือทั้งหมดของการแถลงข่าวที่ทำเนียบรัฐบาลคุณผู้ชมสามารถติดตามได้ทุกวันเวลา 11:30 น.วันนี้ผมธีวัชชูรัตน์พร้อมทีมงานทุกคนต้องลาไปแล้วสวัสดีครับ
เปิดความเป็นไทยให้คนทั่วโลกได้สัมผัส Top of Thai